I am Dr. İsmail from Turkey, more than 30 years in cardiologist, and nearly 8 years I'm doing the practice about the mitral and triclip repair therapy. And today we are here to support our friends, our colleagues, to do Mitraclip procedure.
Could you please explain how what is the mitral valve?
Why the reason today we choose this therapy?
Yes.
Okay.
To our actually followers. You know?
Okay. This patient is now 75 years old guy, and also very significant heart failure, and also due to heart failure, patient has significant mitral regurgitation, mitral valve failure. In this patient now, this therapy is first line therapy in guidelines. It means, what I mean, class 1 indication. Maybe before several years ago, which kind of therapy we can choose now, we were discussed. But now, heart failure and mitral regurgitation under medical therapy, if patient has still symptomatic, and we have to send the patient this therapy.
Thank you.
More effective and more safe.
In what types of patient do you usually recommend mitral valve instead of actually surgery?
Especially the first, this kind of patient, heart failure and mitral regurgitation, this is the first line. The another, if the patient primary MR, what I mean, the problem is leaflet prolapse and leaflet fail, and that patient, and also if the patient has very high risk, and that patient also we can do.
Do you think mitral valve could eventually replace the surgery or not?
Not for a whole patient, but as another valves in TAVI, it's aortic valves. Also, step by step, most of patient maybe in the near future treated by interventional way. It means not surgical, but in the interventional way by cardiologist.
Yeah, thank you. And for final question, how do you usually actually follow up the patients after the mitral valve in terms of imaging recommendations for?
Okay, for example, this patient only one night is still in the hospital. Tomorrow he can be discharged from the hospital, and then he will have some regular medication and regularly control. But now we hope everything is much better than before for this patient.
Yeah, thank you.